The FDA, as you can see, has initiated a process to update their Tylenol labeling to note a possible association of exposure with autism and ADHD. They emphasize, even in their statement, that the associations are not proof of causation, and they acknowledge clinical scenarios where use remains appropriate. The American College of Obstetricians and Gynecologists responded pretty strongly and said, no, there is no reputable study that has shown Tylenol or acetaminophen causes neurodevelopmental disorders, and that the top quality studies found no significant associations. The Society for Maternal Fetal Medicine offered a similar statement, so let's look at what they're talking about. For something like Tylenol, similar to diet or other things, it's very hard to do the best types of studies that we would want to do, something called a randomized controlled trial. So if you do a randomized controlled trial and you tell one group of pregnant women who's randomly chosen to take Tylenol during pregnancy, and you tell a whole nother group, randomly chosen, not to take Tylenol, well, then you can feel pretty good that you don't have anything confounding your study, that there's not anything else besides the Tylenol that would cause changes in autism between those two groups. So if you see a link at that point, you can feel pretty confident that Tylenol has caused it. But the problem is that type of study is very hard to do in this circumstance. And so we're limited to observational studies, which can be limited in certain respects. So first, you have to ask pregnant women, hey, did you take Tylenol during pregnancy? So they might not recall how much they did or how often they did or whether they did at all. And the second thing is that while you try to limit confounders, there are possible things that would explain why some women are taking Tylenol that would actually explain the link to autism. So let's just say you do an observational study and you find that women who take Tylenol more than those who don't actually have an increased risk of children who have autism. It might be that those women are taking Tylenol because they have frequent headaches, and they have frequent headaches because they live in an air-polluted environment. But it's very hard to control for that. And so in this case, it's actually the air pollution or the headaches that are actually causing autism. But because those women take Tylenol, Tylenol looks like the thing that's causing it. And so this is where these studies are confounded by other factors. What are the studies in favor of the link between Tylenol and autism? Well, starting in 2018, there was this meta-analysis that combined the results of a number of different observational studies. There were 132,000 pairs of moms and kids, and they found there was about a 20% increase in women who had been exposed to Tylenol during their pregnancy and their children having autism. Of course, here the authors caution this is an observation, there's confounding, there's no causation here, but that it is an association we should explore further. In 2019, there was a study that did a little bit better. They said, hey, a lot of these studies, you kind of ask pregnant women, did you take Tylenol? How much? And that's not really great. You know, they might have recall bias. They might not know if they took it or not. So they actually looked at the Tylenol level detectable in the infant's umbilical cord at the time of birth. Here, they also did find an association. For autism, it was almost 3 times the level of autism if there was Tylenol present in a high degree in the child's cord blood compared to lower levels or not present. It's important to note that that really only refers to the peripartum exposure to Tylenol, or the Tylenol that you get around the time of birth. So it's hard to say how relevant that is for the rest of pregnancy, but there was an association. So those are the studies suggesting a link, but the most recent and best study we have is actually from 2024. And so this was a nationwide Swedish cohort study. It looked at 2.5 million births, so a huge study. 8% of them were exposed to Tylenol. And what's very interesting is when they did their analysis in the initial way that these other studies had done them, they did find a link with autism. And so there's about a 5% increase in autism with Tylenol exposure. But they did something really important here. For 1.7 million of the kids, basically they were able to do a sibling matched study where they could look at siblings who had differentially received or not received Tylenol. This is a great study because it accounts for a lot of the things that might confound your study. Where you live, who your parents are, what your genetics are, environmental exposures, all these things that you really can't account for in an observational study. Well, what did they find? Well, they found that basically in that group, where it was the best group controlling for confounders, there was no association between autism and Tylenol exposure, one sibling to the other. So this is critical, right? Because they actually replicated the findings of other studies. We're saying, hey, when you do a conventional study, you can find an association here. But if you use this sibling match control, which is the best thing you can do, then that actually goes away. So it is very true to say that the best study we have, the largest in the sibling match control, did not find any link between autism and Tylenol. And so I think now it makes sense in context why ACOG is saying, hey, there is no reputable study that really shows a link between autism and Tylenol. For me, look, I agree. You should not be worried if you have taken Tylenol in pregnancy that you have somehow caused your child to have autism. Even if we took those other studies at face value and said, hey, it's a 20% increase in risk of autism, just to translate what that means for your child, baseline in the United States, there's a 3.2% risk of autism in the general population. Let's just say you believe those original studies, which I don't think we should, but let's say we do. That would mean that your child's risk would go from 3.2 to 3.8%. So we're still talking about like less than 4%. And in those numbers, the absolute risk increase is still quite small, so nothing big to worry about. That said, for me, overall, like I work in the intensive care unit, I'm a pediatrician, so I love what medicines do for children, but I'm also a big proponent of don't take medicine if you don't have to do it. And so in this case, because there's been a signal in the data before, even though it's observational, even though it wasn't sibling controlled, even though we have bigger, better studies now, I say why take it if you don't have to? But if you're a pregnant woman who's suffering, if you're a pregnant woman who is like having high fevers or really in a bad spot, take the Tylenol and don't stress about it. I really worry about the messaging of these things where pregnant people are just told, hey, do this, don't do that, you're gonna kill your kid, you're gonna give them autism, X, Y, and Z, and it just leads to a lot of unnecessary stress and suffering. So absolutely, use it when you have to use it, don't use it if you don't have to use it, and then just don't stress about it. Your child is very likely gonna be okay.